If you are like an average American, you wake up in the morning, have a hot shower, a cup of coffee, and then a handful of pills. Our country is in the midst of a healthcare crisis. And I'm going to demonstrate that by making you do an exercise. No, it's not a marathon or some push ups on your chair. I'm going to ask everyone to put your right hand up. Only put your hands down if you, someone you know, a loved one, family member, has been diagnosed with diabetes. Put your hands down only if someone you know, a loved one, family member, has been diagnosed with cancer. Only put your hands down. I have no more hands up. Now look around you. Oh, one hand. Look around you. Does this reflect a healthy nation? Our healthcare system is so advanced technologically. Could this be making us sicker? We have the top 3 hospital systems in the world. Our healthcare system is so advanced with exceptional and brilliant physicians, yet we rank 37th, according to CDC, in a ranking done for healthcare. The top 3 being France, San Marino, and Italy. According to a study done at NIH, the number of people taking 1 to 5 or more prescription drugs have increased by 25% in the last 10 years. In the same study, it was shown that 1 out of 5 children and 9 out of 10 elderly Americans had been on one prescription drugs, at least one prescription drug in the last 1 month. The most commonly prescribed drugs were asthma medication for children, central nervous stimulant or ADHD medication for the adolescent, antidepressant for the middle-aged, and cholesterol-lowering drug for the elderly. Those without a place for healthcare, prescription benefits, or health insurance were in fact on fewer prescription drugs than those with those benefits. So, what does that make you think? Are we overprescribing? And is it really necessary? When Susan came to me, she was in her early 40s. She had been diagnosed with multiple medical problems: depression, chronic Lyme's disease, chronic fatigue, an autoimmune condition, celiac disease, and depression, to name a few of them. She was on 5 prescription drugs and tons of supplements. She was almost bedridden. In fact, her parents had to fly down from Phoenix to take care of her so that she could function in her day-to-day life. She was on the verge of losing her job, her house, and everything that she had built for herself in the last 20 years. She was seeing 3 specialists: a rheumatologist, a psychiatrist, an infectious disease specialist, in addition to her primary care provider. Now, this is one of the many examples of a disease management system that we have today. Our healthcare system is a disease management system. It is reactive and not proactive, and many times it is restrictive. Let's look at a typical doctor's office visit. It lasts for about 17 to 24 minutes with a mean of about 15 minutes. Is that enough to take a detailed history, do a thorough examination, and most importantly, make that emotional connection with the person sitting in front of you? It's only enough to listen to the symptoms, make a diagnosis, match that diagnosis to the right ICD-10 code so that we can get paid. Now, conventional medicine is very important in our healthcare. What happens when your health issue is given an ICD-10 code? This labels you with a disease. And voila, now you're in a pool of patients with the same ICD-10 code. So if you have diabetes or high blood pressure, you are given the same treatment plan as everyone with the same ICD-10 code. This doesn't take into account your reason for getting that dysfunction. It doesn't take into account your genetics, your environment, or every aspect of your health, physical, mental, and spiritual. It doesn't take into account your whole being. So what if my patient Susan did not fit into that standard of care? Conventional medicine, as I said, is very important for acute care. If you have a cold, you have a pneumonia, you broke a leg, you have a heart attack, it's very good for that. Hospitals bridge an important gap in our healthcare by providing us emergency medical care. In fact, if I have an acute problem, I would rather be in this country than anywhere else. But if you apply that acute care model to a chronic disease like diabetes, it's not going to work. It takes 15 to 20 years to develop a chronic disease, and it's not going to go away by just popping a few pills. When I was practicing conventional medicine, I used to do lifestyle medicine as a form of counseling my patients against obesity, smoking, heart disease prevention, and diabetes prevention. Until I came across an interesting roadblock. In one of my appointments with my patients, he told me, "Hey doc, can we not talk about my smoking or my weight today? Because I got charged $60 for talking to you about it." I was shocked. On one hand, the insurance companies want you to counsel your patients, but on the other hand, they don't want to pay for it. And what happens if they develop a complication? Then they start seeing specialists. And that specialist takes charge or control of the organs that they are trained in. The cardiologist will manage your heart, the nephrologist your kidney, and then you are left taking care of your own health. Now let's look at a different approach. The functional medicine approach, or the root cause medicine. It is a patient-centered, individualized, science-based approach where the physician and the patient come together and address the underlying cause of the disease to promote optimal wellness. It requires a detailed understanding of the patient's genetics, biochemistry, every aspect of health, environment, and then leverages that data into personalized and customized treatment plan to promote improved patient outcomes. With my patient Susan, we used this functional medicine approach. We reduced the inflammation in her body by removing certain foods which were causing sensitivities. We only supplemented her body with the deficiencies that she had from the disease progression and the prescription medications she had been on. We addressed her stress and environment. I understand we cannot go home with our patients, but if we do not address the stress and their environment, we are not addressing 70% of why this disease is progressing in that patient. And this 70%, if we do not address, we are not fulfilling the purpose of why we became physicians first and took the Hippocratic Oath, whose primary principle is do no harm. By using a functional medicine approach, the physician understands the complexity of the diseases. They understand that one disease can have many causes and one cause can cause many diseases. They understand that functional medicine targets the specific manifestations of the disease in that individual. I repeat, it targets the specific manifestations of the disease in that individual. Hence, from a one-size-fits-all solution, it becomes customized and personalized to that individual. By using this functional medicine approach, we look at factors from pre-birth to present. What could have triggered the disease to start? and what are the mediators, or what is keeping the disease from progressing. By managing their stress, we address how stress affects every organ: liver, kidney, heart, brain. By understanding that naming a disease doesn't mean understanding an organ system, and a treated disease doesn't mean a well-functioning human being. By understanding the genetics, we understand that predisposed is not predestined, and your genes are not your destiny. And we can use modifiable lifestyle factors to turn off and on a gene at any time. We have to understand, by using all these approaches, conventional medicine, functional medicine, alternative medicine, and self-care, we can reverse this healthcare crisis. As a physician, I have to understand that I cannot heal the person sitting in front of me, but I can only provide them the tools that they can heal themselves. And I need to honor the individual sitting in front of me because they are as unique as their fingerprints are to their body. As a consumer, we have to understand to ask the right questions. Why and not what disease I have. As a physician, I have to be a coach and a mentor to my patients. I have to involve them in their care so we together can achieve their health goals. And together, we can reverse this healthcare crisis.